Hello everyone, hope you're all keeping well. As Steve has kindly introduced me, my name is Imelda, and that's about there is for me. So I'm delighted to be here today, and I would like to thank everyone who has logged in online to share some of the research findings that I've done for part of my study of my PhD. So before I continue, I just want to acknowledge my supervisors and the School of Nursing and Midwifery in UCC who have supported me, and the National Perinatal Epidemiology Centre in Cork. And I'd also like to extend gratitude to my senior midwifery management team in the Cork University Maternity Hospital for all their support. So just a little bit of background and context. So postpartum hemorrhage is the leading cause of maternal morbidity globally, and that's a WHO statistic from 2023. Severe maternal morbidity has become an important quality indicator for maternal welfare. For each woman who loses her life due to causes related to pregnancy, many more experience life-threatening conditions or long-term morbidities. Within maternity care, there is increase in attention to listen to the women in our service to improve their experiences, quality, and safety. MOH, major obstetric hemorrhage, is the most frequently reported severe maternal morbidity, and the latest findings we have in Ireland is that it is 53.1% of all maternal-related morbidities. So if I could draw your attention to figure 1 on the stage, and if I could draw your attention to the red line. And the red line represents the primary postpartum hemorrhage rate in Ireland over the last 20 years. As you can see on the stage, it has quadrupled in the last 20 years. The orange line just underneath it is the major obstetric hemorrhage rate. And we started recording that in Ireland in 2011. And over the last 10 years, there has been a 60% increase in the range of MOH in Ireland. The blue line is for blood transfusion, but I'm not going through that with you today. So what was the aim of our study? So our aim was to describe the informational needs of women in the postnatal period and the emotional support requiring following a postpartum hemorrhage. There's a lot of research out there to understand how women feel emotionally and their feelings after a postpartum hemorrhage, but we don't know a lot about the women in the short term and the long term after the event. So our focus was on the postnatal period. So I just have a little bit of demographics on the page there as well of the 5 women who participated in our study. And what I would like to draw your attention to is my right-hand side here, so the age of the infant at the time of the interview. So we waited until the woman was at least 6 weeks postnatally before we interviewed them. We wanted to respect the mother's time with her infant at home and for her to adjust postnatally to what she had experienced. And we interviewed the women between 4 and 14 months postpartum. And although the women were postnatal and they had moved on with their lives after the event, they could still recall to us vividly what happened to them immediately after the event and in the long term how they were still feeling. So with our research, we came up with 4 themes from interviewing the women, and this is one of the 4 themes. So I'm actually going to recite to you some of the women's words that we learned in the study. So all the women in our study were given pseudonyms, and in order to take part of our study, they had to have had a postpartum hemorrhage of 2.5 litres and above, and they had to be admitted to HDU, so we had a purposeful sample. So Sarah mentions, it was a very frightening experience where I had to distance myself from what was happening and tell myself, it's okay, they know what they're doing. Claire, I didn't really realize that something was happening to me and that the reason I was in HDU, I thought it was because of the emergency cesarean section. The information I needed to reassure me was slow to be given. It trickled in from hearing the midwives hand over to each other. Those little bits of information were like little snippets. So the women could recall specific details about what they experienced and their emotions that they were feeling. Some women talked about the pain they experienced and expressed that they would never forget the amount of pain they were in. Other women had blurred out moments in their memory about the debrief that they had gotten when they were in the HDU. Each of the postpartum hemorrhage cases in this event were managed in a timely manner, and there were no subsequent deterioration of the women's condition following the postpartum hemorrhage. So as you can see here, the women recalled how the event felt to them. Some of the women mentioned that they felt an influx of people coming into the room. They can remember, having their arms pulled out. But at no time did the women feel that while the staff in the hospital, what they were doing to manage the event, they weren't traumatized about that. They understood the steps that had to be taken to stop the bleeding. It was the after effect, the debrief, the information that wasn't given to them, and that is what was causing them to have issues longer down the line. The second theme was informational gaps. So Claire mentions, the 2 bleeds were due to what's called placenta abruption, and then I had another one due to uterine atony, and the only reason I knew what that was, those words, my husband is a doctor, so he was able to explain that to me. The information was not ideal in the way it was presented to me. Veronica, I asked the staff on the ward what happened, and they read my notes and said I was so lucky. Until that point, I didn't realize the seriousness of the bleed, and I questioned, could I have died? One woman stated that she learned what had happened to her from overhearing the staff discussing her care and handover, but she was not involved in the conversation and the decisions that were being made without her perspective or input. Other women would hear information and Google it, what it meant, or as I have read out, they got information from the PPH from their partners. So they weren't getting the information from the staff, they were getting it from other sources. Most women asked the midwives on the postnatal ward for answers about the bleed, but the postnatal staff were unable to provide the women with what they needed as they had limited information of the event. As I have read out Veronica's statement, she was not in a life or death situation during that postpartum hemorrhage. The event was managed well, and she went to HDU for monitoring, but the way when she asked the midwife the question, the words that came back to her was, I was so lucky. So she started questioning her mortality. Women were unable to get information that they needed after leaving the hospital from the GP. Only one participant, Veronica, considered that she was given an adequate debrief following her postpartum hemorrhage. She attended her private consultant at the 6-week postnatal check, and she was given the opportunity to ask questions and to be told about the event. This was appreciated by her. Perception of staff. It was pretty scary when I got up there and realized there was no one here to help me. It would be just me and her, to her baby, for the first time. I would get out of bed and bring her infant, to bed to feed, and I didn't know if I should be ringing the nurse, midwife, or the staff members. I didn't know what was normal or what to a degree was worse because of the bleed. The women recalled their experience of postpartum hemorrhage as part of the interview schedule. They spoke of the influx of HCP or healthcare professionals into the room, and others spoke of the manoeuvres that were done to stop the bleeding. Although this was not a nice experience for women, they all understood why the healthcare professionals done the steps required. Most participants reported the staff midwives were extremely friendly and did what they could, but they noted that the wards were very busy and that the women wanted to go home to get additional support from their family. The fourth theme was enhancing future care. If there had been an informational booklet with practical ways to care for mum, baby and partner, that would have been beneficial. If they had said you're going to need a lot of support, you're probably going to nap a lot and you're going to need someone to help you to make food and assist you, you can forget about the washing. If something like that was said, that would have helped a lot. There were many practical suggestions made by the women in this study, including additional information. So to be told that you would need to rest. Some of the women weren't in general when they have postpartum hemorrhages, if they're minor, might not realize that they need to rest their bodies to be able to recover. They would need more support. Their partners need support as well. So the partner needs information about how to support the woman and themselves after the woman has experienced a postpartum hemorrhage. Adequate debrief, additional information in regards to diet, healing, what is normal blood loss. The effects of postpartum hemorrhage on your milk supply coming in. Some women in the study, their milk supply may not have come in for 10 to 14 days. The women resulted with guilt, felt it was their fault, not realising that because of the severe of their hemorrhage, it affected the supply coming in. So to give the women that information would reduce the likelihood of them feeling stressed and guilty, and maybe it could prevent babies going on supplementation. They needed more time and support with the staff while they were in the hospital. They asked for an information leaflet to take home that recapped the information that they may need to be able to care for themselves, because they felt the not knowing and the not trusting caused doubt. They also suggested a visitor overnight would be beneficial for them. So where have we gone? So just to recap, so a severe postpartum hemorrhage may have short and long-term complications on the woman. There is a huge adjustment from the high dependency unit. When our women go into HDU, they're cared for generally on a one-to-one basis. So they have that support, they're cared for. If they're getting up and about, there's someone with them. Then we, as healthcare professionals, know that they're clinically well to go to the postnatal ward, but the woman may not get this information. So she goes from a huge transition of being in a one-to-one environment, and then she's transferred to a postnatal ward. And she might be in a private room, but she may also be in a room of 4 or 6 or maybe 10 beds, and she's alone. And that's probably the first time since she's had a postpartum hemorrhage that she's been alone. So there the doubt comes in of, what can I do? Can I get out of bed? Am I allowed to get out of bed? She doesn't know what she can do. So more of a debrief or information to the women to let them know that they're stepping down, or we're stepping down the care, and that this is the normal progression for them to go home. A lot of the women have unanswered questions, so we interviewed the women between 4 and 14 months postpartum. As I had mentioned earlier, to take part in this study, you had to have had a postpartum hemorrhage of 2.5 litres and above, and also you had had to have gone to HDU. As part of our ethics, any woman, because of what we're discussing, could cause the woman to become upset or to cause any kind of problem. So we would refer the women into the hospital for a debrief. One of the women who we contacted for the study did not know that she had had a postpartum hemorrhage. The second woman was aware that she had had a postpartum hemorrhage and had a lot of unanswered questions, but wasn't ready to discuss them as of yet. They were both very happy to take part in the study. They felt it was important for future care. So we gave them the information so that they'd be able to come back and make a debrief in their own time. They also, and I've mentioned all the additional information that they wanted, and a more formal debrief. We're quite good for the major and severe postpartum hemorrhages getting formal debriefs postnatally, 6 weeks' time, but sometimes the mild postpartum hemorrhages may need it. So the importance of asking the woman after her birth, how was her experience, could be one way of identifying women who may have additional needs or support. So from this research, as is part of my PhD, what we are trying to do in UCC and NPEC is to develop a care pathway for women. So after they have a bleed, mild, moderate or severe, the woman is central to the care, and we're trying to incorporate her physical needs, her emotional needs and her informational needs, that we can standardise the care that she's getting, but individually make it for each woman as well. Just like this paper as well has just been published in the European Journal of Midwifery, and they're my references. Thank you very much.